a positive reaction in the sense that the Commission recognized that there have been some historical differences in terms of those amounts, and we did not have a good way to reconcile that with our existing resources. So this proposal would allow us to align those a little bit more. The other thing you had asked about, what are we doing to encourage this advocacy contracts to really focus on local advocacy? And so one of the things we recognize is that a lot of there has been an emphasis on advocacy at the state level within some of these contracts, in part because of the amount of funds that were available. Some of the contracts with NAMI, for example, where they have more of a statewide reach, have been very active locally. The United Advocates for Children and Families have been setting up what they call a parent cafe model, where they're actually building out the capacity to engage at the local level. But the Commission also I think we see these as an opportunity to extend the eyes and ears of the Commission, recognizing both the value of ensuring that the perspective of persons with lived experience and their family members is engaged in that policy process. This is also an opportunity for us to hear from advocates around what's happening in the communities around the state and to understand where there's quality, where there are challenges, to help us think about the topics that we're pursuing in terms of our drill down, understanding what's working and what's not, in terms of focusing our attention around how the resources are being used, where there's a need for innovation. So we very much want to sustain the ability for these folks to engage here in Sacramento, but fortify their voice at the local level. This will help us do that.
Excellent. LAO, Finance.
Yes, Lowell Welch, Department of Finance, and we support the OAC's April proposal. However, we don't have a position on the additional $1.5 million.
Got it. Thank you. And public comment.
Thank you. Rusty Steelix, Mental Health America of California. Mr. Ewing's explained the rationale for it. All of these groups are really being asked to do the same thing. They don't have equal capacity to do so. We think the new structure of competitive grants will allow the Commission to structure them so that we get the maximum value out of these, and that all the groups will have the resource to do that. I don't think I need to explain all these special populations and why they need representation. I think that's fairly apparent, but they all really are special and important populations whose needs have not been met. So thank you.
Thank you.
Good afternoon. Stacy Hiramoto, Director of REMCO, the Racial and Ethnic Mental Health Disparities Coalition, and we really want to thank the Commission for, at long last, promoting and allowing us to bid for these contracts. And we really support the augmentation, because I think you would understand that without the voices of knowledgeable people from racial and ethnic communities and the LGBT community and others, that reducing disparities is not brought up or let alone made a priority. So again, we support the augmentation, and thank you again.
Thank you. Next witness.
Good afternoon, Madam Chair. I'm Pashi Michelson-Walker. I'm the LGBTQ Program Director for NorCal Mental Health America, and I was the director for Phase 1 of the California LGBTQ Reducing Disparities Project. For the Reducing Disparities Project, we traveled extensively throughout the state, meeting with LGBTQ stakeholders and community members. What we found is that there are a great number of disparities when it comes to LGBTQ mental health and well-being, and yet local advocacy efforts on behalf of these populations are spotty and most often non-existent. We found the top barriers to advocacy efforts were lack of resources, including lack of a statewide guiding organization. We also found that on a statewide level, LGBTQ stakeholders and advocates are often unable to be present at crucial policymaking hearings and meetings. Again, the barrier is lack of resources, especially funding. On behalf of LGBTQ stakeholders throughout California, many of whom could not be here today, we strongly encourage you to approve this funding request, including the augmentation. Thank you so much for your time.
Thank you for coming. Next witness, please.
Good afternoon, Madam Chair and members. Joe Michael for Equality California. We just want to state our support as well of this proposal and thank the commissioners for considering it and for bringing this forward. These are all tremendously important populations, but just to speak specifically to the need of the LGBTQ community, for example, LGBTQ youth are up to 4 times more likely to attempt suicide than their non-LGBTQ peers. So there's a tremendous need there, and being able to include that population along with the others that are hopefully going to be funded through this opportunity, would be a really tremendous impact for the LGBTQ community that previously has not existed. So we definitely support that very strongly and want to make that clear today, including the augmentation. So thank you all for considering that.
Thank you. Next witness, please.
Karen Savage, National Alliance on Mental Illness of California, and we want to thank the OAC and the staff for all the work on this and support over the past many years. Just a couple comments. One is that we really want to encourage there to be partnership between the different populations that are being served by these contracts. We don't, for example, have family members who are not also from diverse communities, so we really want to encourage there to be some work on that. And then it's also, I really appreciated the question here in the report about how do these contracts impact the local level and our local communities, and that really is the heart of the MHSA. And, you know, I think some of the work that we do is talking to our 62 affiliates about how do you work with your local county and how do you participate in the stakeholder process. And we've heard some concern today about is that happening and how is that happening. So I want to highlight that these are really a way to ensure that that participation is happening. And then one of the other things that came up today was, are we evaluating outcomes? How are we tracking that? Where is the data? And so I would encourage that to also be a theme through these contracts and to make sure that any additional augmentation, which would certainly be great, falls along those lines too, and that we are evaluating outcomes and putting additional funds into places where we are seeing outcomes and where we also know that we need to see additional outcomes where there is an additional need. So thank you.
Thank you.
Good afternoon, Adrienne Schulten from the County Behavioral Health Directors Association. Also support the proposal here. The groups that have been contracting with the OAC have offered a very specific expertise, I think, to help support the implementation of the Mental Health Services Act. And so we're pleased to support this and also see the addition of the LGBT. Thanks.
Thank you. Appreciate it. Moving on to issue 5, reappropriation.
So let's see. You have a proposal in front of you to reappropriate existing dollars. Basically, what we're asking is the ability to spend money that was provided to us in prior years to roll that forward. We've gone through some staff transitions, particularly in our research and evaluation team. As referenced in the analysis, the commission a few years ago adopted an evaluation master plan that really is sort of a set of guideposts for the commission. And one of the observations we've made is that in addition to, there's 3 or 4 ways in which we're doing research. Some of it is very traditional program evaluation. California's mental health system is this mosaic of probably 5,000 or 6,000 approaches. And so we're doing an evaluation of individual programs on a project-by-project basis, and that's where the evaluation master plan is really helpful in terms of how should those dollars be allocated. What we're also doing is through this more hands-on dig-in around what's happening in terms of criminal justice and mental health system, for example, we're working with the California Department of Justice and with counties to see if we can actually do some data matching to really begin to map which mental health consumers are becoming involved with the criminal justice system and under what scenarios, and what are the opportunities to enhance diversion, right, as well as improve the ability to transition someone who may be involved with the community mental health system into a custody environment where there's a continuation of the kinds of care that we're getting in the community, both into that custody situation, and then most importantly, on the back. There you go, that's right. And so as we've begun to really try to focus and prioritize, we haven't spent all of the research dollars this year that we have available to us. And so what we're seeking from you is authority to allow us to extend the expenditure of those dollars for an additional year. We're also, built into this, I believe, is the reappropriation of some triage dollars, in part because some of the counties have been slower to get up to speed in terms of that, those programs, as we talked about earlier.
It was the contract, not the triage dollars.
So Norma's going to straighten me out here, which she does every day.
She shook her head. I thought, oh,
I got kicked under the table. So explain that.
The contract. We have a contract for the 5150 through, it was a legislative proposal for $400,000 with CIBHS. And so we're just struggling with some of the deliverables for that contract.
Okay.
So we're just asking for an extension to allow the contractor a little bit longer to complete that deliverable.
Got it. Those were some of the unforeseen circumstances.
Yes.
It's a polite way of putting it. Okay.
Polite on behalf of your staff.
Say it again.
Your staff.
Got you. That got you. She's very polite. LAO, Finance, any public comment?
Oh, no, okay.
What, after 6 years, you're still not running up to, 6 hours, you're still not running up to the mic to provide us with comment? I'm so disappointed. Okay, thank you for that. We're going to move on to our final item for today under item number 0977. Thank you very much.
Thank you.
Appreciate it. And this is the California Health Facilities Financing Authority. Thank you for hanging in there with us. And we're going to hear issue 1, Investment in Mental Health Wellness Act of 2013. We're on page 48 of the agenda.
You ready? Thank you, Madam Chair. My name is Diane Stanton. I'm the Executive Director at the California Health Facilities Financing Authority. For a bit of overview, in June of 2013, SB 82 was signed. It created the Investment in Mental Health Wellness Act grant program, supporting new and expanding mental health services, both in 3 primary areas: crisis residential, crisis stabilization, and mobile crisis. The legislation also authorized CHAFA to create and administer the competitive grant program. $142.5 million in capital funds was allocated to the authority for this purpose. There was also $4 million in MHSA funds for personnel expenses. A very quick update. To date, the authority has conducted 4 funding rounds. We are in the process of finalizing our 5th funding round. But through the first 4 funding rounds, we've awarded approximately $115 million to about 45 counties to date. We've also received disbursement requests from about 21 counties, and those disbursements total about $25 million to date. We've had numerous programs that have opened, numerous projects that are still under completion and under construction, but to date we've added about 70 new beds. That's both a combination of youth and adult, although I would say majority, a very high majority are adult specific. In addition, we've added approximately 60 vehicles across the state to help with the mobile crisis teams. We've heard anecdotally from our hospital partners that they have seen a decrease in patients coming into ERs with mental health issues. And we were talking with Valley Children's Hospital in Madera, and they had noticed Fresno has a youth, 8 beds for youth, and Valley had noticed a decrease in intake through the ER as well. On to our 5th funding round. We are on track to make final awards at our May board meeting. We received about 20 applications across the state. Those applications totaled about $27.5 million. The only program, there's a couple of things and changes that we did in the 5th funding round that I did want to highlight that was different from the first 4 rounds. In the first 4 funding rounds, we had the state divided into regions. And so in some cases, in all cases except in the case of LA County, there were regional counties that were competing with one another. We wanted to make sure that we had an adequate disbursement of funds across the state. So this created a little bit of a challenge. In some cases, we were not able to fully award county requests because we wanted to distribute funds and award as many meritorious projects as possible. So in the fifth funding round, we eliminated those regional caps and made it just a statewide competitive across the board process. The other thing that we did was we added some flexibility in the program buckets, and that's my terminology, but we wanted to make sure that to the extent that there was $25 million in crisis residential, but counties had needs outside of that. For example, they wanted to increase mobile crisis and increase vehicles. We wanted to make sure that there was some flexibility and latitude and that the funds that were available for the fifth funding round didn't preclude counties from applying because their needs may not align with the funds that were available in each of those buckets. The third change that we did was we included peer respite. So with SB 75, it clarified that peer respite was eligible for these one-time dollars. So and that level was capped at $3 million. So in this funding round, we did receive approximately 6 applications, and that is the one program that has, we've exceeded demand for the funds that are available. And like I said, we are on schedule to make those final awards at our board meeting on May 26th.
So was your shift in round 5 in terms of the lack of kind of regional focus to kind of the wide open? Is that because you felt in rounds 1 through 4 that you got a kind of a fair, equal distribution across the state?
Yes.
Okay.
Yes, 1, and 2, we wanted to make sure that given this was the last funding round, that we had full opportunity and
For everybody.
full opportunity to really do programs that may exceed what those regional caps had previously.
Got it. Okay.
Again, our objective was to make sure that, counties felt that they could apply for any and all of the funds that were available as opposed to have some of the...
They were liberated to shoot their best shot.
Exactly.
Got it.
Exactly. So on to question number 2 about some of the difficulties in getting the crisis residential and crisis stabilization programs up and running. I'd like to, as I mentioned, we've had about $25 million in disbursements to date. Don't confuse the disbursements with the progress of these programs at the county level. Many of the counties, while CHAFA allows for counties to apply for funds either on a reimbursement or on an advance, most of the counties are set up to do a reimbursement. So we've had very few counties that have come in and claimed funds in advance of actually drawing them down. So there's a little bit of disparity, and I don't think that the disbursements to date accurately characterize and represent the county progress that's been made to date. But to that point, though, there have been some challenges at the county level, including the internal, what I'll call bureaucracy, and working with different departments within the county, whether it's the planning department or it's needing to get approval from Board of Supervisors or finding matching dollars because these grant dollars aren't enough to execute the program and meet the county need. And working with the real estate department and divisions. There's also been some challenges with identifying properties that'll work in neighborhoods. There are some NIMBY, not my backyard issues that the counties need to overcome, and just the real estate market is sort of taking off again, and so oftentimes properties will be identified, but counties can't move quickly enough to actually secure and move into an escrow process for those specific properties. And then there have been some issues about the county relationship with nonprofit providers. So in many cases, counties work with nonprofit providers to make sure that services are being delivered. And so our regulations were, I would say, unclear. And so working with our county partners, we did make clarification to further clarify that, yes, those relationships can exist, and that if the county has a relationship with a nonprofit provider or wants to engage in a contractual relationship with a provider, that either the provider or the county could also claim these funds. And so that, I think, helped ease some of the challenges they were having on that front. Moving on to question 3, there will be, based on the applications that we received in the 5th funding round, there will be some dollars that will go unawarded. Just, you know, I think the counties would be in a better position to articulate why, but I know crisis residential has been particularly difficult and particularly challenging. And so we expect there'll be about $5 to $6 million that will go unawarded. Obviously, peer respite, there's a higher demand for peer respite, but unfortunately, we won't be able to meet all of those requests. And so as the statute currently reads, those funds will revert back to the general fund at the end of this fiscal year.
Okay.
And then there are, as far as what we expect as far as unclaimed and returning funds back to CHAFA, it's the exact numbers on that, it's still a little too early for us to give you an accurate answer, and we can certainly keep the committee apprised as we hit some of the milestones. But there are really 2 conditions under which funds would come either revert back to the general fund or come back to CHAFA. The first is the unawarded dollars; those will go back to CHAFA, and again, we'll know, or those will go back to the general fund. Excuse me, and we'll know more about that after the board meeting at the end of May. The second is grant applications. The project costs maybe came in lower than expected or projected. Abundance of caution, they estimated a little bit high, created a little bit of a cushion. And then as those disbursement requests come to the authority, we do all of the verification and double checking. And so in some cases, again, it was just that cushion they didn't actually need. In other cases, though, there have been expenses related to the projects that aren't eligible for reimbursement. Again, these are residential environments in neighborhoods, so you want to make it homey and comfortable and relaxing. Artwork, landscaping, those types of things aren't eligible for funds, but it's clearly important for the facilities. And so we'll have a better idea as some of the disbursements come in. But to date, we've had about $454,000 that had been awarded and had not been utilized by various county projects. We expect that number to go up a little bit more, but we really, it's really too early and too soon to know. In other cases, we've also worked with counties where costs have come in lower than expected. LA County, I think, is a great example. They actually had excess funds for the mobile crisis vehicles that they wished to purchase, and we said, well, you've got enough money, let's buy another vehicle. And so we were able to work with them to really turn that positive situation into greater benefit to LA County in this case, but there are other counties that I could provide examples for.
So, and what do you plan to do with the unclaimed money?
I think one of the things that we do need to get clarification from is if those funds come back to CHAFA, could we push them back out again, or do we need to bring them back to the general fund? So that is a point of clarification that we do need to work on going forward.
Okay. Great. Any questions of comments by LAO? Finance?
Mayor Kasagan from Department of Finance. Just want to note that the statute allows them the authority to spend those money up to June 30, 2016. So to the extent that some of the funds would go back, it would still be in their books and there are options to handle them.
Oh, okay, so it wouldn't go to general fund, it would go back to them, but for that current fiscal year only?
It depends on what the program need is, but we will have to look at reappropriation.
Okay. Thank you. And public comment.
Rusty Salix, California Council of Community Behavioral Health Agencies. I guess to get a clarification, I was a little bit confused by what Finance said, but it was our understanding this program sunsetted June 30th, 2016, and the funds would flow back to the general fund. We think the need is overwhelming. Find a way to keep the funds so they can be reallocated in this program in 2016-17. Or then if this program's got to go away, then transfer it to the Oversight Commission for the new children's program we're creating. One way or another, the need for these crisis facilities is so great. The other point I wanted to make is that the issue with the private agencies, Prior to SB 82, every single crisis residential facility in the state was owned by a private nonprofit. None were county-owned. And this program was designed to make it difficult to have private agency ownership. The regulations went pretty far in trying to fix that. My conversation with Ms. Standen just a few hours ago suggested it might not be as clear as it needs to be, and there might be a need for a statutory amendment. So hopefully we can bring this back. It may revise and maybe have an answer then if there is a need for a clarification. The projects are just now getting out to bid for the private providers, even though the statute was passed in 2013. And so we're just now encountering some contract limitations that people are finding not easy to work with, and we're trying to figure out what's it take to solve that. So we're just getting that information this week, and hopefully in a few weeks we'll know more whether there's something needed or not.
Thank you, sir. Next witness.
Adrienne Shelton with the County Behavioral Health Directors Association. Also just wanted to echo Rusty's question around the unspent funds, or the funds that weren't applied for and what happens with those. But also just wanted to commend CHAFA and the staff for their expert work with CBHJ and counties on the implementation of this program. There's clearly a need. There's clearly a need to expand them. We were also very pleased to work collaboratively with CHAFA to allow counties the option of the peer respite. And so as you see from the staff report, that's oversubscribed. So there's clearly a need for that as well. So really just wanted to publicly thank the CHAFA staff. Thanks.
Thank you. And final witness.
Karen Savage, National Alliance on Mental Illness of California. I also really wanted to commend CHAFA on their work on this program. We've seen a tremendous benefit to our members across the state. And we recently surveyed them on a number of issues, and one of the things we asked them was, do you have access to a crisis stabilization facility? Do you have access to a mobile crisis response team? Which is not to say that they're all coming from the SB 82 program, but 75% of our members and affiliates told us that they now do have access, which is also not to say that every time they need access, there's a spot for them or there's a team for them, but we thought that was really tremendous improvement, and so we appreciate the work, and we hope to see it continue. Thank you.
That is significant. Thank you very much. We will hold the item open. I want to thank, as we just cross over the 6-hour mark, I want to thank committee staff, Minority Caucus staff, sergeants, department agencies and staff, LAO, finance, advocates, and members of the public who participated in today's hearing, and the Sub 3 hearing stands adjourned.